consider myself a disability rights activist and working for social justice. And so the work that I do is always around promoting equity and social justice. I was supported by Canon Collins in 2014, 2015. And then I graduated with my master's in June of 2015. And my work then was about the community integration of male mental health service users following their discharge from a step-down facility. And the reason I got interested in that work was because I was supervising students at these placements, and the program that we were offering them as occupational therapists or mental health practitioners really wasn't preparing them for their lives outside. It was just giving them and their family a respite, but it wasn't really considering what they're going back to. Occupational therapist, even though I work in community, it's a very medical model that we operate in because it's located in health services, and health services is all about clinical recovery, which is symptom reduction and medication adherence. But as an occupational therapist, I'm interested in what people do that have meaning and purpose for them. So what's their identity besides this health condition? I started my career at Valkenburg as an occupational therapist when I just graduated. And so I think God always has a way also of bringing you back to things when you have unfinished business. When I started working at UCT, Valkenburg then became one of the sites because it's a teaching hospital. And through my work at Valkenburg, I got to know of the Friends of Valkenburg. So the organization started in the 1990s, and the organization is really around how do we support service users and staff to support the recovery of service users. One of the things that is important for us is to destigmatize mental illness, and also to think about how do we help people reintegrate into their communities. And so Friends of Valkenburg has different projects. So they've got the healing garden now, where service users can work in the garden, but that you can always also harvest to sell. We have a Fashionably Friendly, which is a thrift shop where people can come and shop. You know, one of the things about being admitted to hospital is the lack of choice and autonomy. And one of the other things that Friends has is a clothing bank. So people, when they get discharged home, they can go to the clothing bank and get an outfit, but they can also go and buy something in the shop to take home to their family. And then we've got now 2 baristas who are actually service users who were trained by a well-known coffee shop to be baristas, and so all the coffee snobs who are frequenting the hospital can get good coffee there. And then we have the takeaways. And then one of the other projects that we want to really work on is around what I said earlier, around nurturing the entrepreneurial spirit. So all of our things have a dual function. It's a service to the hospital and the staff, but it's also an opportunity for service users to get skills. So we're looking for funding for our hairdresser and barbershop and a nail care service, because you know, when you become ill and if you have a mental health condition, self-care is one of the first things to go. And often people know someone is not well by how they look. And so just getting reconnected with yourself and looking at that personal hygiene and self-care is really important. And so that's what we want to do. But we also want to offer it as a service to people coming in where they can pay for their nails or for their hair or that. So I think one of the things is really important is to communicate to people that you matter, and how we do that is through the environment. So although Friends of Valkenburg is on the property of Valkenburg Hospital, it doesn't feel like you're in an institution, because the scenery is beautiful. You can see the views of Table Mountain. It's also on prime contested land, so I think people are after the land also. But it's really just a nice space. And there's no apartheid. So sometimes you have separate spaces for patients and for staff, and we don't really have that in that space. We try to encourage people to come out and to donate, especially if you are downscaling. Lots of people now are moving from bigger homes to smaller homes, and so Friends of Valkenburg will take any donations that people want to give and then resell it within the shop. So yeah, so that's the Friends of Valkenburg leg of my life.